we don't have a lot of, I don't have a lot of time with you guys on a continuous basis, right? To work with you about, your job, kind of your role here at the company, where our company's going, what we're trying to do. Some of you guys went through a long orientation where you got enough of the philosophy side of what the Good Looking Company is doing, but others of you haven't. And unfortunately, it's very difficult to separate, have 5 days of orientation for everybody who comes on board. So for posterity, maybe some of this video will be used for that, but for you guys who are already here, I want to take 4 days to really define out what you guys are doing here, what we're doing as a company, and how everything fits together that we're working on, okay? When we moved away from Health Trust Software and became the Good Looking Company, and it is my goal that we officially transition solely to the Good Looking Company with this software redesign, okay? So March or April, every single thing about our company will be rebranded to the Good Looking Company, okay? The way we answer the phones, the invoices, the software, the login screen, all of our services will be under that Good Looking Company umbrella. Okay, so we have 2 months really to get our act together to make sure that we live up to the perception and make it the reality of what the Good Looking Company really is. When we made that split from Health Trust Software, I told you guys that this was a different company, that your role was different. And I'm talking specifically to the healthcare advisors, but this applies to everybody who works at the company. In the past, our healthcare advisors were called customer support representatives, right? You guys sat in a cubicle, you answered the phone when somebody called in with a software problem. Your goal was to resolve that problem on that phone call as quickly, as professionally, as accurately as you can. That is not your role at the Good Looking Company, okay? You guys were transferred in as healthcare advisors, which means it's your role to advise a list of healthcare customers. The only way you can advise healthcare customers is if you know more than they do about their operations, and more importantly, about the way their operations should in fact look and run. You're not software advisors, okay? Yes, you are answering calls about software right now at times, but you will be very quickly advising home health agencies and other healthcare entities on how to run their full operations. Okay, so you need to know what that looks like. You need to know what the best practice of running a home health agency looks like, but you also have to have the personality, the authority, the mindset, the communication skills, the leadership skills to walk into a room with a chief executive officer or a chief financial officer or an administrator in DON and be able to hold your own and gain their respect by the things that you know, the way you present yourself, the way you present information, and the way that you help them grow, okay? I'm telling you guys that now. I warned you at orientation originally, and anybody who's signed up with us since then, you know that the standard I have for the Good Looking Company is leaps and bounds above the standard we had at Health Trust Software. So far, we have not had the time to really start implementing those things, but you're going to see that very rapidly escalate, and so I need you guys to become true healthcare advisors / consultants, okay? Even those of you who aren't necessarily advisors like Kim or eBay who are working in our home health agency, at this level of the company, your role is not only to do a job, intake, QA, compliance, answering software questions, but it is to help us structure the company, structure training materials, structure advisory materials in such a way that we can utilize that in all of our other businesses and help our customers with it. Okay? So today we're very quickly going to run through how a company is started and how its operations are set up. Over the course of the next few classes, we'll get into some of the leadership and communication styles, etc. But today, it's very objective, right? How do you start a business? In this case, let's run through and just say Adam is interested in starting a home health agency. He's naturally entrepreneurial. He's seen that he's worked in healthcare for a couple of years, and so he's interested in opening up his own home health agency. Let's talk through the steps of how that idea becomes a reality and how it becomes a successful reality. Okay? All right. What I expect you guys to do over the course of this week, I'm not giving you notes, okay? I don't have time, unfortunately. I would love to. Eventually, I hope somebody steps up and it turns these things into documentation, but right now I don't have time to do that. So I'm expecting you guys to take notes on this and be able to do this again on your own, okay? Because the reality is when you go out and meet with ABC Home Health, if you don't understand what they had to go through to start their company, you're not going to be credible to them, okay? If all you know is how to conduct intake or run orders, or how the software, if you click this button, the software does X, Y, Z, you're always going to be a software advisor, not a healthcare advisor, okay? So this is the very foundation of how to start a business, in this case, especially a home health agency. The vast majority of the stuff we're talking about works for any type of company. There's just a few nuances that would need to be changed. Okay, so Adam has this idea of starting a home health agency, and he lives in Austin, Texas, so he naturally wants to start that here in Austin. The very first thing that he will need to do is determine what his market is going to be. Just like any business, he has to have customers who are willing to pay money for the services that he provides in order for him to stay in business. So he does an analysis. Okay, he's interested in home health. There are a number of different home health specialty types. There's the non-medical home health agency that sends basically babysitters and housekeepers into patients' homes to take care of them, companion services. There is pediatric therapy providers rendering physical, occupational, speech therapy services in the home to kids. There is adult-based home health agencies who send nurses into a patient's home to give them medical care, and a number of other specialty types that go along with that. Adam doesn't really know exactly what he wants to do, but he's accustomed to, he's been around some Medicare agencies, so that's the decision that he goes with. He wants to serve the elderly by giving them skilled nursing services in their home. So what we would start out doing is creating a market profile in this area to see if it's a viable business. Okay. Intuitively, we can say, sure, it's a viable business because we see other Medicare home health agencies in Austin, Texas, surviving or thriving. Right? That's the easiest way to understand whether you have a market for a particular product is, do you have direct competitors who are already successful? If so, is there something you bring to the market that will allow you to take some of those customers or to expand the market to have customers? If you come into the industry offering the exact same thing that someone else does or that multiple people do, how are you going to differentiate yourself and make money? So as you're doing this market analysis, we would need to understand how many, what's the population in Austin, what's the population of patients who qualify for Medicare as a payer source, how many physicians or referral sources, because knowing home health, we're going to have to get an order from a doctor to refer those patients to us. What can we reasonably look at as our customer base? In healthcare, that's going to be called your census. If you're running a retail operation, that's the number of customers who walk through the door, or a traffic count. If you wanted to run the local subway, they're going to be interested in the traffic count that goes through on Anderson Mill Road, because that tells you a basis of people who could potentially come into your store. Right? If you're running a subway, people aren't going to travel 100 miles to eat at your restaurant like they would Salt Lick Barbecue, which is more of a destination restaurant, right? So this Subway's, when their primary concern is how many cars drive down this road and what's the median income of the people in this area, because that's our customer base. Running a home health agency, you have to do the same type of analysis. In the area that we're going to service, how many patients qualify for our service? If it seems like you can be profitable, okay, at that point, you make the decision that you want to go into business. So the next thing that you need to do is establish your company formation legally. Okay. In most states, the state of Texas included, you can simply open up a business as a sole proprietorship using your own name. So Adam can start selling cookies under Adam's own name, and that's legitimate. Maybe not cookies in large scale, because you have to have a government license at some point. But in the beginning, you can do that. Now, opening a home health agency entails a great degree of legal risk. So people set up in corporations. They either incorporate or they create some type of legal entity like a limited liability company in order to offset some of that liability. The easiest entity, corporate entity type that you can set up that's a hybrid that gives you kind of the best legal liability benefits, protections, and also the lowest cost of just keeping up with the corporate governance is going to be a limited liability company. Okay, so just kind of walk through the business entities that you could choose. You could choose an actual corporation, what they call a C corporation. That corporation requires a number of government forms, government taxation documents, and it requires that you have a board of directors run and be responsible for that organization. Now, a board of directors can consist of 1 or 2 people, but there has to be a board of directors that actually is legally responsible for that company. In addition, you have to have annual minutes, meaning that board of directors has to meet once at least. With every state, it's at least once a year. They have to keep minutes of that meeting, meaning everything that's discussed has to be documented in some type of formal document that gets stored in the corporate records, which could just be a shelf, right, or a bookcase. The reason a lot of people don't start corporations is because you do have additional government regulations. right? You have to keep those minutes. You have to keep separate records for accounting. You have to have a board of directors. Your board of directors has to have a meeting. You are required to give notice of that meeting in advance. So if you're running a mom and pop, if Adam's going to be the only owner of this particular business, most of the time he's not going to choose a C corporation just because of the oversight activities that have to go into it, right? Every minute you spend creating minutes and notices to a meeting that you're the only person who's going to attend, the less time you have to actually run your business. Okay. The most common type of entity that you, and probably what would be recommended for you to use, is a limited liability company, which is kind of a blend between a sole proprietorship or a partnership and a corporation. It gives you legal protection, meaning if someone sues your company, if they sue Adam Home Health LLC, Adam's primary home and his car and his 401k from his old job can't be touched, right? So Adam, if he starts this home health agency and one of his nurses gives the incorrect medication and one of his patients dies, if Adam was a sole proprietor and that patient's family sued Adam, they could potentially take everything Adam owns. In the scenario of him setting up a corporation or an LLC, they can sue Adam Home Health LLC, and they may potentially take everything that the LLC owns, but Adam as a human being still has all of his stuff intact, right? They can't get his house, they can't get his car, they can't get his personal funds in the vast majority of cases. Right? So that's the primary reason people set up a corporate structure, in this case an LLC. The LLC, you do have some corporate documents that you have to file. We'll talk about some of those in a minute. But in general, they're very relaxed. Okay, it's designed to be a very easy entity to oversee from a governance perspective. Okay, with an LLC, you don't have to have a board of directors. It can be, in the state of Texas and in most states, you have two different ways of running the LLC. One is called member managed. So if you think of a corporation, you're familiar with the concept of having stocks, right? One corporate entity may have 1 million shares of stock, right? So 1 million pieces of ownership, to make this real simple. 1 million pieces of ownership of that company. With an LLC, you also have shares. They're not really stock, but you would have shares. So if Adam had a business partner and both of them own half of the company, one may own 500,000 shares and the other may own the other 500,000 shares. The company can be member managed, meaning that Adam and his partner share in running the company on a day-to-day basis, or they can be what's called manager managed, meaning you hire another entity as an employee to actually run the operation. Okay. The way that looks in effect is that Adam and his partner own the company, and the company may hire Adam as the manager to actually run the company. Okay. It's very similar to how we're set up how we were set up under Health Trust, right? Health Trust as an entity had owners, but Health Trust was manager managed by me, right? Who was also one of the owners. And so the other owners had no actual authority over the day-to-day operations of the company unless they changed the bylaws, right? So there's legal ramifications for how you set that up. All right, so let's say Adam's, before we finish, we'll run through, you of course could have started a sole proprietorship or a partnership, the only difference being whether one person owns the entity or multiple people own the entity. In that case, there's virtually no legal protection. If you have a partnership and someone sues the partnership, they can take, if they win, they could take everything that both partners own. So it's very rare these days for sole proprietorships or partnerships to get established just as such. You can have an LLP, a limited liability partnership, it effectively operates the same way that an LLC does. So you kind of have an idea of what that looks like. Okay. All right, so Adam decides to set up an LLC. In order to do that, he's going to have to file a document with the Texas Secretary of State. The Secretary of State in most states, if not all states, is the government official responsible for commerce in that state. Okay, so every year we elect, or every election we have, we're electing like a governor and a lieutenant governor, and I think in the state of Texas they appoint a Secretary of State. And so if you go to the Texas Secretary of State website, you will find all kinds of legal forms, filing documents, etc. So the first thing now that Adam has to do when deciding to file his LLC is he has to come up with a business name. Okay, it has to be a unique name, at least similarly unique. The way the state of Texas puts that is that you can't, the first two words of the filing have to be unique. So probably setting up Adam LLC is most likely going to be taken, right? There's probably another company that has Adam as the first name of their filing. In the case of the GoodLooking company, our official name for the corporation is GoodLooking LLC, and it's actually one word, GoodLooking. When we went to file that, even though it's a pretty unique name for some reason, there's a company out of Houston called GoodLooking Glass. 3 words, GoodLooking Glass. Secretary of State wrote back and denied our application because it's a duplicate or a similar name. So we had to talk to GoodLooking Glass and have them sign off on a form giving us permission to use a similar name, right? So when we did, we set up 7 or 8 different GoodLooking entities, all LLCs, to operate different parts of the business. Right, so you go on the Secretary of State's website and you would find a form for filing an LLC. A lot of people will go to a service like LegalZoom, okay, to fill this form out for them. The benefit of a service like that is it's cheaper than an attorney, and they give you they fill out the form for you, and they give you your operating agreement, and they may even, if you pay them, they'll get your tax ID number from the IRS. The reality is none of those things is really difficult, so we'll go through this manually. You go to the Secretary of State website, you download a form for filing the LLC. As you guys are taking notes, all of our healthcare advisors, you have an assignment this week. I would like for you to find that form as if you were filing an LLC, fill it out by hand, and bring that to me by next Wednesday. Email that to me because I'll actually be in China, so that's probably not a good deadline. Anyway, we'll add up all these assignments. By the time we get back from China, which is February 14th, so your Valentine's Day assignment, whatever that Monday is, after the 14th, first assignment that I want is an LLC form from the Secretary of State filled out for your own name LLC. I want you to see what that form looks like and what it encompasses having to fill it out and send it in to the government. All right, after you have that filed, you'll send that into the Secretary of State along with a check for $300 or $325 if you want it expedited. If you expedite it within just a few days, you'll actually get a letter back from the Secretary of State letting you know that you're an official entity in the state of Texas. You will have a file ID number, which is your file number with the Secretary of State that you'll use for a number of other purposes. Okay. In order to finish setting up your LLC, you will need an operating agreement. If you had created a corporation, you would have other governing documents. You would have your articles of incorporation and your effectively an operating agreement that says how the company is going to be managed on a daily basis. It's like the constitution for your company, okay? So if there's ever a dispute amongst the partners or the owners, if one of the partners dies, if one of the partners wants to sell their shares, if you want to bring on new investors, if you say we don't want to have a annual meeting anymore, all of that is governed by your operating agreement, okay? That's what the courts will ultimately look to if there's a dispute between owners. All right, so you'll need to set that document up. That's a rather in-depth document, or should be a rather in-depth document, but it's also a very standard form. Okay, you can find those on the internet. Like I said, LegalZoom will build one for you, but you can find those on the internet relatively inexpensive and modify it, or have a lawyer modify that to get you up and running. But that's going to determine ownership percentages, generally the starting members of the company, how the company is organized and operated, how you're going to elect the board of directors, how you're going to handle dividends, right? Because the whole idea is that you started a business in order to make money, right? Hopefully you had other motives to go along with that, but if you don't make money, you won't be a business very long. And therefore, as the business starts making money, remember you're getting paid. Adam isn't getting paid. Adam Home Health LLC is getting paid. So how is Adam going to get money out of this corporate entity? Okay. So there has to be documentation that identifies how Adam is going to get paid from the funds that Adam Home Health LLC has. Right. The next thing you would need to do is set up your employer identification number with the Internal Revenue Service. Okay, of course that's federal. Sounds complicated. In fact, it's really easy. You can go online. There's an electronic form on the IRS website. You give them a little bit of information, they'll give you a tax ID number. If you're a single member LLC, the IRS will actually send you two tax ID numbers, one for Adam as a personal employer and one for the LLC. You're basically going to do everything under that tax ID for the LLC. All right. Then you would want to go set up a bank account. This one seems odd, right? Because you can normally just walk into a bank and say, I'm Adam, here's my $50 to deposit, I need a checking account. When you're starting a business account, you have to have those documents that show that you're a legal entity. They usually will want to see your operating agreement and your tax ID number. So you take that package to a local bank, like across the street to Wells Fargo, and say, I need to set up a corporate checking account. That's going to be in the name of Adam Home Health LLC. That's very important from a legal perspective, because if Adam runs his business using his own checkbook, right, as Adam, rather than as the home health agency, the courts will call that commingling of funds. If you don't run your business as an actual business, if you continue to run it like a hobby or as just part of Adam as a person, right, and somebody decides to sue Adam Home Health LLC, remember that protection we talked about in the beginning. If that person then shows, hey, Adam he didn't show this as a home health agency, I was doing business with Adam, and to prove that, here are the checks, right? I wrote a check to Adam, not to Adam Home Health LLC, and we can get into Adam's books and see that he's treating his business like his own personal bank account, and the courts will typically remove, they call it piercing the corporate veil, they will get rid of that protection because Adam didn't run his business as an actual business. So it's very important to set up a business account and run it legitimately like a business entity, because it's not Adam, it's Adam Home Health LLC. Now, if you'll remember last election cycle, if you guys keep up with politics, Mitt Romney, who was had a billionaire effectively, was running for office, running for president. He got in a lot of trouble because he made the statement that corporations are people too. And there was just this, a big uproar about how rich people, are so out of touch with reality to think that corporations should be able to give political speeches, pay for political ads, etc. Well, his off-the-cuff remark was corporations are people too. Well, politically, it was a really stupid thing to say, right? Because people were mad about how much money Wall Street executives were making, etc. And to basically any common sense notion of what a human is, a business entity isn't one, right? Adam's a person, but Adam LLC isn't a person. Legally, though, Adam Home Health LLC is a person. Okay, it's a separate legal entity. It has its own voice. It has its own rights. It has its own legal protections. Adam LLC can actually sue Adam as a person, and Adam can sue Adam Home Health LLC. Okay, so it's very important to remember there is a distinction, and that distinction has to be kept at the forefront of all your business operations. So you set up this bank account, you get your checkbook. You're going to need to set up some type of accounting system to keep track of all the money that comes in and out of your company. As a person, when you get your paycheck, it goes into your bank, and you write checks, and hopefully you guys reconcile your bank accounts. With online banking the way it is now, if you're like me, it's like, okay, you trust the bank and good is good enough, right? There's money in the bank, so we're good. You can't do that as a business, because as a person, at the end of the year, you're going to have to file your IRS, your income tax, right? You guys don't have to keep up with a bank statement to do that, because your employer is going to provide you with a W-2 that says, here's how much money you made, here's how much you paid in Social Security taxes, here's how much you paid into the government in advance for your income tax payments, right? And you're going to take it to an accountant, or you're going to go to whatever the online service is and fill out your taxes, and hopefully you're getting a refund back. As a business, there's nobody who's going to tell you, here's how much money you made and here's how much you spent, but you still have to file several different taxes each year, tax forms. Okay, so you have to be able to keep up with all the money that came in and all the money that you spent. And there are a number of other items as well. Like if Adam put money into starting Adam Home Health LLC, that's his. There's a capital contribution account, or a capital account, that has to be kept track of for Adam to know what his basis in the company is worth. So later on, 10 years from now, when Adam wants to sell Adam Home Health LLC for $10 million, the government's going to tax him for $10 million worth of income, right? Unless Adam can show that he put $1 million into starting the company, and that would be his basis, and he would be paying taxes on $9 million. Don't take that to the bank. That's very simplified terms, why we have accountants and CPAs. But you have to have some type of accounting system to keep track of everything that comes in and goes out of the company. Okay, most businesses, or a lot of small businesses, use something like QuickBooks. Okay, QuickBooks is by far the most popular small to medium-sized business accounting package. Larger companies, you'll see them start to use, there are several different packages out there, but that will combine payroll, accounting, etc. Okay. But QuickBooks is kind of it's almost like Google instead of saying a search engine, right? It is the accounting package that's most common, so you can get by with saying QuickBooks in a lot of situations. People know what you're talking about. All right, in order to start a home health agency or a number of other business entities, you have to have a business license. Okay, we set ourselves up as a business entity, but that doesn't give us permission to actually perform certain services, okay? And there are a number of these. For instance, if you wanted to be an attorney, there are obligations and requirements that you would have to have. You can't just set up a company and say you're an attorney and start selling legal services. There are laws against that. You can't open up a beauty salon. right? You can't just start cutting hair and taking payment for it because the government says you have to have a cosmetology license or something similar. Same thing with home health. Okay, so if you go to the Secretary of State website, there will be a listing of businesses that require extra licensing with the state of Texas. Any type of healthcare provider that's actually providing clinical care requires a license as well. In this case, since Adam is going to render home health services, clinical home health services, remember that sitter, attendant care type stuff we talked about earlier, they generally don't require a license. But in the state of Texas for clinical care, you have to have some type of business license. Right now, that's operated under, so the Secretary of State says you have to have a business license, but there are other entities that are responsible for actually giving you the license, right? The Secretary of State doesn't know much about cosmetology, so there's probably a cosmetology school or accreditation body that says you're qualified to cut people's hair. Similarly, with home health or healthcare in general, there are organizational structures designed to prove that you are able to render home health services. In our government in the state of Texas, that's the Health and Human Services Commission, which is the highest level, it's under the Department of Health. So we have the Department of Health Services, DHS. I guess underneath that we would have HHSC, and underneath that we would have DADS, the Department of Aging and Disability Services, whose specific responsibility is dealing with health care provided to the elderly and disabled. Home health is licensed underneath that particular entity. In order to service Medicare patients, in addition to having a license, Adam also has to be certified. Okay? Hence why if you look on the DAD's website for your provider license, you have different categories. You have a licensed category, which means you're licensed in the state of Texas to provide home care. You have a licensed and certified designation, which means you're not only licensed to provide care in the state of Texas, but you're also licensed or certified to receive funds from the Medicare program. Without that certification, you can't really, you can serve a Medicare patient, you can't get paid for it, right? And then there are a couple of other designations like, what's that? Yes, you would have to have for, and yeah, as part of your licensure application, which is assignment number 2, I want you guys to fill out an application for a home health license. To make this easier for you, and since I'm going to be out of the country and not really wanting to answer questions, that should be Form 2021, right? So that's the, as you're checking, that's the form you want to make sure. Don't just search for Form 2021. I'd like you to pretend that you're a home health agency having to figure this out for the first time. Okay? I want you to see what goes into that document. As part of that licensing application, you'll see that there are extra requirements that we haven't discussed, like healthcare providers have to have a national provider identifier number. It's similar to your tax ID number as a business. It's a national database that gives an individual identifier, like a social security number, to healthcare providers. So you can go to the NPI website, fill out your information, and get an NPI number. That's what you're going to use whenever you bill Medicare or commercial insurance companies, so that they know who you are, that you're a verified entity. One of the oddities about all of this that we're going through is that each of these things is siloed, right? The Secretary of State doesn't tell Medicare that you're a healthcare provider, and Medicare doesn't go to the Secretary of State to see that you're a healthcare provider. Your bank doesn't go to Medicare to see that you're making money, right? There's this loose collaboration that happens, but it's very much siloed. So you have to take the initiative to make sure that you're in compliance with all of these organizations. Okay, so at that point you fill out your licensing application. You would send that into the government. Depending upon how you're going to get licensed in the state of Texas, you could either have a survey by DADS, who's responsible for making sure you turn in your license, and you can start admitting patients once they approve that license, but you're not going to get paid for it. Right? So you're going to start servicing these patients, but the government has to then come in and say that you are a valid home health agency, okay, that you're actually doing things correctly. So they're going to have a surveyor walk in your door and check through your patient records, your financial records, your employee records to make sure that you're abiding by the licensing standards for a home health agency. To diverge for just a minute, I know we're almost out of time, but give me 7 more minutes. In order to be licensed in the state of Texas, right, you have to live up to licensure standards. So part of that application is going to be that you agree to be bound by the licensure standards of the state of Texas. In Texas, that's Chapter 97 of the Texas Administrative Code. You would have to read through all of that and be in compliance with all of those rules and regulations. If you want to be certified, part of that statement is that you will be bound by the rules of the conditions of participation for the Medicare program, which is, we call the COPs, which is the Code of Federal Regulations, Chapter 484, subsection C. Right? You'll have to track that one down yourself too. All right, so the surveyor comes in. And if you've lived up to all of these obligations, at that point they basically say you passed your survey and you're able to start receiving payment for services, depending upon the payer source, right? If we're dealing with Medicare, at the same time that we filled out our licensing application for the state of Texas, we would have had to fill out what's called an 855 application to be part of the Medicare program. Okay, so the state says if you're going to service Medicare patients, you have to be licensed and certified, live up to both credentials, but the state isn't necessarily responsible for enrolling you in the Medicare program. So you have to fill out this 855 form, which is a pain in the ass, but that gets sent off to CMS or to a CMS contractor like Palmetto GBA. Okay, they process that application, and if everything is okay, at some point they're going to put you into the Medicare program, give you a Medicare provider number that identifies you as a Medicare participant, and enroll you with, you would also need to enroll, and usually this is done as part of the same type of application, they're going to enroll you with billing privileges to your Medicare contractor, right? So you can get a Medicare patient, you can serve a Medicare patient, but if you don't have the ability or the credentials to send a claim to Palmetto, who's the Medicare contractor for the state of Texas, you're not going to get paid for anything that you do. So generally that's part of that application, right? You have a couple of other options for going through that licensure process because the state of Texas is often backlogged with their surveying office. There was a time, I'm not sure where we're at right now, but there was a time it would take 18 months to 24 months for a home health agency from the time they started receiving patients. Once you start receiving patients, have your first patient on board, that's when you can notify the surveyor's office that you're ready for survey. If you're looking to get certified, that has to be 10 patients that you have on board. At that point, which for a small company may take 6 months to get up to 10 patients that you're serving, if those are Medicare patients, you're not getting paid for them, right? You could have like a private pay arrangement where you're getting paid by the patient, but until you get to 10 patients, you're just sitting there not making money for the most part. Then you can put in and tell the surveyor's office that you're ready for survey, and then you go on the list. The problem is that list is so backlogged, it may take another 18 months before the surveyor comes to see you. And at that point, it may take another 3 months for Palmetto to finish processing your application. So 2 years into this starting up Adam Home Health LLC, we may actually get our first payment. Okay, so you can see how costly it is. Okay, so a lot of home health agencies, if they're trying to bootstrap this, you would typically be looking at a nurse who's working full-time as a nurse at the hospital, who on the side is starting a home health agency. She's trying to get patients who really don't need a lot of home care services, so she can see them one time a week or one time a month and still call them a patient, but you don't have a lot of cost associated with caring for that patient until you get your survey and credentials, and then at that point try to ramp up your home health agency. There are a couple of shortcuts, even though they're not really designed as such. Okay, the state of Texas and Medicare have given what they call deeming authority to a few entities that can serve in place of the state surveyor. The most common one for home health is CHAP. You also have JACO, the Joint Commission of Accreditation for Healthcare Organizations. CHAP is Community Health Accreditation Partner. And then you have ACHC. Anyway, either of those three are private organizations that have their own list of healthcare standards, which are generally seen to be more restrictive, better quality than just the default state requirements. Okay, so you can choose to become CHAP accredited, and if CHAP accepts you into their program, they can send their own surveyor down to ensure that you're in compliance with CHAP accreditation standards and also Medicare standards and also state standards. And if they say that you are in compliance with those three, the state of Texas and Medicare both accept that in lieu of their own surveyor giving you that thumbs up. Okay. It's much quicker from a timeline perspective to go through like a CHAP accreditation. CHAP and ACHC really grew in size over the last 5 years because in the state of Texas, there were so many home health agencies opening that the survey office was backlogged. And so rather than spend 2 years waiting to get paid, you can get on a CHAP list where you may get surveyed in a matter of a month or two. Okay. But again, when I say it's not designed as a shortcut, right? You still have to live up to CHAP accreditation standards, which are more restrictive than what you would have to do just as a licensed and certified agency. But it will get you up and running and able to bill a lot sooner. The thing is, from that point on, you still have to live up to CHAP accreditation standards, right? Okay. Just real quickly, as this business is set up, okay, we've gotten our license, we're a business entity. Now we would need to set up our actual governing body, which will be the people who are responsible for overseeing the operations. In a corporation, that's the board of directors. At an LLC, that's the owners, okay? Or you could set up a separate board of advisors or even a board of directors and give them authority per your operating agreement to be responsible for the company. If we're looking at, let's say you went with a CHAP accreditation, you have to have a set governing body who's responsible for the operations of the company, and they have to meet frequently, which we say is twice a year, in order to oversee the operations of the company. You have to have a PAC, which is a professional advisory council or committee that works underneath your governing body. That group is designed to oversee the quality of your company, to make sure that you are living up to the standards of a home health agency. Okay. And then, of course, as any business, you need to have policies and procedures that dictate how you operate on a daily basis. If you opened a Subway franchise, they're going to give you a book about here's how we order lettuce, right? Here's how we store lettuce. Here's what you do when lettuce is brown, right? That's what a quality organization would have in place. If you go to the local mom and pop diner, they're just going to say the lettuce is brown, throw it out. They're not going to have anything written down for that. But as an organization grows, it's not good enough to rely on common sense, because unfortunately there are very few people in the common sense isn't very common, right? So organizations that expect to grow and thrive have written policies and procedures. In healthcare, that's a mandated requirement. You have to have written policies and procedures that dictate how you're going to operate, and there are many of those that are actually spelled out by law that you have to have. I'm assuming that's Mark telling me that. I don't know. Somebody wants to text Mark, maybe they can figure out what he needs. All right, so you need your policies and procedures that will dictate how you're going to operate. You obviously need to start recruiting staff for each of the positions that you're going to need. By law, you have to have an administrator who's responsible for the day-to-day operations of the agency, and you have to have a supervising nurse, or what we generally call a director of nursing, a DON. You will need to establish a QA/PI committee that's responsible for the clinical care, doing chart audits, et cetera, and then reviewing those to create a plan for making your agency better in clinical care and quality assurance. And then, of course, you need all of those roles that you're familiar with home health, from intake to scheduling to order management to your clinical team, your QA and your quality assurance team, your medical biller, your collections team, your managers, your marketing staff, your recruiting staff, right? You have to be able to run your business. So Adam's going to start recruiting people to have a quality company. All right. We're going to we'll end off right there. Tomorrow we'll talk a little bit about just kind of the tax structure that has to go into some of the general reporting and requirements that you have to do on a daily, weekly, monthly basis, etc. Okay. Any questions before we shut down for the day? All right, you have 2 assignments. So by the time I get back, at this point in time, there'll be more that we add over the next few days. But right now, by the time I get back, you guys should be on your way to starting a home health agency.
Well, I had one question. That CHAP and JACO, is that something that home health companies, if they have that certification, that they advertise as a standard? They have
generally, yeah.
Okay.
Yeah, and originally that's how it was sold, right? Is that you get this accreditation and people then know that you're this quality organization. The reality is in home health, it doesn't help all that much because most hospitals are going to be JACO accredited. Very few home health agencies are. And doctors generally, no offense, but they would rather know you than CHAP, right? So at the end of the day, it didn't matter all that much. And so what's really spurred their growth is the fact that they can do a survey and deem you as a home health agency. But yes, theoretically, the marketing would be beneficial.
Would it be with the license already there? Like you was going to take over a home health agency? Do you have to require a new license, or can you take over their license?
If you were to buy a new an agency that already exists, that's what you're doing, is buying their license. That's the value of purchasing that company in most instances. So yes, there's a value associated with just that number and the Medicare certification. You do have to fill out additional forms, a change of ownership form, and effectively, like in the state of Texas, you still have to fill out that form 2021 again, and you have to fill out your 855 again, but that number would just transfer to you. You wouldn't have to go through a survey. You do have to go through a change of ownership survey, but it doesn't stop you from billing like you would at a normal, like when you're starting up a company.